name is Luizilda de Oliveira, and I'm the Director of Nursing and Care Management at La Clínica del Pueblo. My role at La Clínica del Pueblo has really been to develop the nursing and care management department. For this specific purpose, it really has been like standardizing workflows for delivery of care while focusing on clinical and social determinants of health. Care management has evolved since the start of the Bridging the Gap and reducing healthcare disparities in diabetes care because of these grants in like different kinds of ways. If we looked at how we manage diabetes prior to this grant, and then how we organize our care team, there's a lot to say about practice transformation. The grants looked at a small subset of patients, but we were able to implement the best practices with the clinic flow. So even if a patient was not part of the Bridging the Gap, we looked at them at the same ways. We have evolved. We have done, La Clínica is known for care management because we have worked with Ryan White clients for many years. But at the time, we were mainly looking at patients living with HIV. The care management activities really allowed us to be able to look at standards of care, and the standards of care say like a diabetic patient needs A, Y, and Z, regardless if they're HIV or if that's the only diagnosis they have. So that some of the principles that we had from the beginning really helped us a lot, and even training our team to be able to say each condition is as similar as HIV. HIV has a lot more long-term side effects. Diabetes has them too as well. So that was like a really important message to give to our team. And that was kind of like that shift, like people are like, oh, diabetes is as important, because I was like, yes, with HIV you have this and you have that, and with diabetes you can lose your sight, you can lose your sensation, and then so that really is to make sure that the team could all march the same direction, or the boat could go in the same direction. What was the most memorable change helped improve the diabetes care for patients? I think was beginning to use Prepare. Prepare is the protocol for responding to and assessing patients' assets, risks, and experience. So it has subsets of questions that is looking at different areas of social determinants of health, like lack of transportation, literacy. And so it's just having the smartphone formulating a score is very helpful for the team as well. Where before we used to create templates, with Prepare, it's like when I want to review where our patients are trending to, I can get all of the Prepare results, and it's really, really easy. Where compared to previous years, we used to have drop-down questions, and that was very complicated. So using the Prepare tool has really been a game changer for all of us. Our team here in La Clínica focuses on both medical and social needs when providing care to diabetic patients, because not all patients that have diabetes have care management, right? But one of the things that is very interesting is to talk about social determinants of health. Do they have food? Like, is food insecurity an issue? And then, so yes, if the food insecurity is an issue, then let's connect those patients to a care coordinator. They're not going to provide them care coordination for a long time, but then they can provide them resources and be able to tell the team too, does the patient have insurance? Make sure that the insurance is active in the system, and ask them if there is something, because the most interesting thing when you work on a team-based care is that everybody always knows something about the patient that nobody else knows. It's changed a lot. It changed a lot because there's this element of, before I could tell a patient, did you pick up your medication? Yes, I did. And then I'll call the pharmacy and they would be like, oh yeah, they picked up the long acting insulin, not the short acting insulin. Before I would be like, okay, bring me your medication so I can look at it. And it would be super easy. They would just walk into the clinic and they would be like, I have 2 minutes, and I'd be like, I have 5, and then we'll exchange that as a nurse, right? Then now, like, we didn't have that opportunity of seeing each other. But then the most interesting things were like, can you take a picture? Can you text me a picture? I think that in the beginning of the pandemic, we started to use this. I think it was One Talk. I think through Sprint, and then so we could text patients back and forth. So it was just, we were shifting all the time, and I was shifting along. What are the lessons or changes from the pandemic that we should carry forward in diabetes care? I have to say there's a couple things that have come through, and in the literature, and then things that we're doing. I think one is telehealth. Telehealth should not go anywhere, because it's allowing us to seek care a little bit different. And I have patients, for example, that are they're so lonely on this side of the world. And then as they're lonely on this side of the world, they might be able to go to their countries for like a 3 months, and their insurance company will actually provide the medication. And then they can have their appointments from there. One of the things that I really would like to see in the care of diabetes is for clinics like us to be able to get funding to do remote monitoring for diabetic patients. I think that that will be another game changer, because one of the things that it's really challenged is to shadow people from their houses to come to have those appointments. And then if the provider can get the blood sugar results electronically, and you can actually look at the trend, we are looking at a couple of things. Decrease of lost wages, because every single time like a patient comes to an appointment, they have to finance transportation, they have to ask for permission at work, and a lot of us are still like living paycheck to paycheck. So you calculate, and then just food access as well. Then we can say, we see that your A1C or your blood sugar is now well controlled. There is these places here, we can apply for these benefits, or you can get a fresh bag of food, because DC is great at finding different resources. So I think those are the things that really will be able to help us in the future, and spending less time like being in the clinics to be everything to be solved here. Because I think the pandemic in itself has just woken a lot more problems, social and clinical, and then we need space and time to make sure that we can be efficient. And efficiency is going to be telehealth, remote monitoring for hypertension and diabetes, making sure that we have platforms where we can track patients' benefits without making all of these phone calls, because like nobody's answering their phone lately. But we can go into different platforms to be able to figure out, did that referral that I made to SNAP, is it really there? Has it been approved? And so I think that the pandemic has taught us a lot. And I really I feel some kind of a way when people say like, when we go back to normal. I was like, no, there is no normal to go back, because that normal was not working. So we need to find a new normal in healthcare, and this new normal is to looking at innovation, looking at technology. Not that technology will solve all the problems, but technology will be a vehicle of collaboration with our patients. Because sometimes we think that elderly patient might not be able to use a Bluetooth enabled glucometer, but with proper teaching and having a team that is dedicated and is open to helping, we're truly going to get there.